Hi friends, welcome to Origyn Fertility and IVF. I am Dr. Rashmi Sharma. So the topic of the video today is a very sensitive topic, which is missed abortion. I'm going to tell you why missed abortion happens, what is missed abortion, what are you going to do now that you have been diagnosed with missed abortion, and what can you do in future to have a healthy pregnancy. Before that, if you wish to come to our center, you can see the number on the screen below. You can give a phone call and take an appointment. If you wish to take an online appointment, you can see the link of the online appointment in the description box below. You can take an online appointment. Coming to the topic of the video today, which is missed abortion. As the name suggests, missed means it has been missed and baby is not live. So missed abortion means you are pregnant, pregnancy has not been expelled by the body, and the heartbeat is gone. So usually within first 3 months of pregnancy, when the heartbeat is gone, it is called as missed abortion. Usually there are no symptoms. It comes as a very shock to the patient, and in fact they are devastated when we do an ultrasound and suddenly we see that there is no heartbeat. They're just not able to digest the fact, because as per them till yesterday everything was fine, they can feel everything and there's no symptom at all. Now that you have been diagnosed with missed abortion, the question arises that how do you deal with it? How do we clean the uterus? So first thing that I would like to say is that it is not a medical emergency. If you wish to wait, you can wait for 4 to 5 days. So usually what we do is that we like to wait for 4 to 5 days, so that it gives time to the patient, number one, for psychological adjustment. In 4 to 5 days they come to actually accept the situation. Second thing is there is a repeat ultrasound after 4 to 5 days, that if by mistake it was an early pregnancy and that's why the heartbeat was missed, in 4 to 5 days we will be able to see the heartbeat. So it is better to wait for 4 to 5 days, repeat an ultrasound again and confirm the diagnosis of missed abortion. Okay, now let's say it has been confirmed that it is missed abortion. So that means we need to clean this uterus, we need to terminate this pregnancy. There are 3 ways of terminating this pregnancy. One is expectant management, where we don't do anything and we expect the body to expel the dead pregnancy tissue on its own. The second is medical management, where we give you some drugs to help the uterus to expel this dead pregnancy tissue. The third is surgical management, wherein we do surgical cleaning of the uterus. All the 3 managements are okay. Some have some good effects, some have some side effects. So let us discuss those. So if somebody is going for expectant management, it's okay, because there will be many patients who would not want their body to be touched, who would want it to be as natural as possible, and it is okay. It is perfectly all right. The only thing is that should not wait for more than 2 weeks. If in 2 weeks also pregnancy has not been expelled, please take help from your doctor, because it has been seen that after 2 weeks the chances of having infection due to dead tissue lying in uterus is pretty high. The second is that you don't know when the abortion will start. So you're not sure of the timeline. You may be sitting somewhere and suddenly the pains and then the bleeding might start. Okay. So the second management is medical management, in which 2 types of pills are given. One is mifepristone, which is an anti-progesterone drug. It is given to eat orally. Okay. Progesterone is basically a pregnancy maintenance hormone, and if you give anti-progesterone, we expect to cut off support to this pregnancy. And then after 24 to 48 hours, another drug, which is misoprostol, is given either orally to eat or sometimes vaginally if the bleeding has not yet started. What does misoprostol do? It softens the mouth of the uterus, which is cervix. This is number 1. Number 2, it kind of initiates the contractions in the uterus to expel the pregnancy tissue outside. That is medical management. Almost 70 to 90% of the cases, medical management is successful in completely cleaning the uterus. In about 10 to 30% of the cases, there will be some pieces remaining inside. So it is said that after medical management also, after about 10 to 12 days, you have to repeat an ultrasound to confirm that there is no dead tissue remaining inside. If by chance the dead tissue is still remaining inside, we will need to do a surgical DNC. Now we come to the third type of management, which is surgical DNC or surgical management. DNC is dilatation and curate. Dilatation is we kind of dilate the mouth of the uterus, which is cervix, and with the help of surgical instruments we try to clean the uterus. So the advantage of surgical DNC is that it is quick. You don't have to wait for a week, you don't have to wait for 2 weeks, and it is painless. Sometimes it is done in anesthesia, sometimes it is done in sedation, so it is quick, easy. Just in one day you are over with it. So it sounds like easy, but the side effect may be that you are surgically doing it, and sometimes because of overcurettage, because of the uterus may have some adhesions, some infections, right? So normally in our practice we like to avoid surgical procedure. We want the patient to have medical management, and if medical management has failed, then we proceed to surgical DNC. In some cases DNC may be indicated in the first attempt itself, like if there is a patient who is anemic, and or if there is a patient who has some clotting problems or some bleeding disorders. In that case also we would prefer to do DNC as a routine. So this was about the management. How will you manage this pregnancy now? Now coming to why it happened. That is the question which really troubles the patient. First of all, I would like to say, do not blame yourself, please. You have done nothing wrong. No physical exertion, no food can lead to missed abortions. In most of the cases, missed abortion happens because the baby was abnormal. So it is a nature's way of removing an abnormal baby. It's an abnormal baby which cannot survive. So stop blaming yourself. So in about 60 to 70%, it was the baby which was not normal. In some cases, like 30-40% cases, there could be some maternal factors. Like there may be a wall in the uterus, which is septum uterus. Sometimes your blood has clotting disorders, and the baby's circulation is very tiny circulation, and a clot went to the baby's circulation and then leads to stoppage of the heartbeat. Sometimes there may be some infections like rubella or some viral infections. Sometimes there may be some hormonal problems like uncontrolled thyroid, uncontrolled diabetes. Sometimes there are autoimmune diseases, like your body's immunity is active against your baby cell. Okay, so there could be many reasons. Now what do you do for the next pregnancy? Okay, how do you carry forward yourself for your next pregnancy? So I would say what our guidelines suggest is that if it is just the first loss, usually no tests are recommended. We usually take it as just pure bad luck, and you go ahead with the second pregnancy, right? But if there is a patient who has lost 2 or more pregnancies, or if there is a patient whose pregnancy itself was so difficult, like it happened with IVF or IUI, or if you are on the higher side of the age, like more than 35, then of course we are not going to wait for a second abortion. In that case, tests are advisable even at 1 abortion. Okay? And there are lots of tests to be done in that case. We have to check the DNA of husband and wife. We have to do 3D ultrasound of the uterus, or maybe a hysteroscopy to rule out any abnormalities in the uterus. We have to do a whole battery of blood tests called as thrombophilia to see whether you have any clotting disorders, and sometimes anti-thyroid antibodies to rule out autoimmune disorders. So on our channel we have a detailed video. The link will be given in the I box up, and you can go to that video and see what tests to be done if you have lost 2 or more than 2 babies. All said and done, in the end I would like to say, please don't worry. I know you are really troubled. It really comes as a bolt of thunder, but it is very common. 1 in 4 pregnancy aborts, and does not mean that the second pregnancy cannot happen or a third pregnancy cannot happen. And usually most of the patient will ultimately have a good, healthy live birth.